Good morning, everyone. Thank you for joining this session, and I would like to thank the IHCC organization to give us this opportunity to take you through our journey in how to build and implement Qatar Biobank Laboratory. Our presenter will be Eiman, Monika, Noor. The presenter have no conflict of interest or commercial base to declare in relation to this presentation. In the first part, we will speak about establishing a biobank laboratory, planning and implementation. The presenter will be me, Eiman Alkhayat. I am as a lab manager, and my colleague Noor Hamade. Our objective: identify key requirements for establishing a biobanking laboratory, understand the 12 quality system essential as parallels of successful laboratory organization. We will introduce the laboratory scope, covering pre-analytical, analytical, and post-analytical requirements. Then, we will demonstrate the advantage and disadvantage of manual and automation of sample processing and storage management. Our content will be introduction, quality management system, specimen collection and the process, lab operation, manual and automated, sample storage, and finally, facility and health and safety. When we start to implement any laboratory or any organization, we need to build strategy. We need to put our scope, our strategic objective, our plan and goals, what the resource required to implement this organization, and what the stakeholders, the internal and external stakeholders. We will start talking into 12 quality system essential to establish and maintain the sustainability in laboratory. These 12 quality essential system can be considered as a guide when establishing a lab, and we will be highlighting them throughout this presentation. 12 quality system essential are a set of quality standards that provide a framework for maintaining a quality management system in biobanks laboratory. These quality essential systems include aspects such as management responsibility, document control, personnel training, equipment management, process control, and customer service. Each of them is essential to ensure accurate, reliable, and consistent result in biobank laboratory operations. Now we will speak about the facility and infrastructure requirement. I handle this part to my colleague Noor.
Hello, everyone. Thank you again for giving us this opportunity to speak today. Our first quality system essential will be discussing facilities and infrastructure requirements. The three main resources to take into consideration when establishing a biobank lab are financial, facilities, and personnel. A budget should be put into place taking into consideration the number of personnel needed, inventory required, and equipment. Facilities should be adequate depending on the processes being performed. There should be enough space, properly designed and constructed rooms, and proper environmental control measures. Thirdly, personnel working in the lab should be competent and able to perform the tasks assigned. As mentioned, Facilities should be adequate depending on the lab processes. Some space requirement examples are: workstations should be spacious enough for work being performed, meet ergonomic standards, strong enough to hold equipment. An office space should be provided, which can also be considered as a clean area, meaning no samples or contaminated equipment allowed inside, for staff to do office and admin work related in the lab. UPS and generators are important as they are a backup power supply in case of power failure, and rooms requiring electrical supply should have UPS outlets installed. As I mentioned, environmental control is an aspect to be considered when designing a lab. It is important that the lab workstations are kept clean at all times. This can be achieved by establishing workspace decontamination procedure, as well as routine housekeeping. Next, biological cabinets and negative pressure rooms can be implemented if samples and processes require so. If automation and instruments are used, the noise level, electrical testing, waste management should all be factored in and controlled during the processes. Rooms should be temperature controlled and monitored for temperature-dependent equipment and temperature-dependent samples. The lab requires many equipment and consumables, reagents. These should all be housed in a proper way to not cause any clutter. Therefore, a designated storeroom should be another consideration in the lab. This storeroom is also temperature and humidity maintained to not spoil any inventory or reagents. Within the storeroom, adequate shelving and cabinet spaces are useful to organize the item, making them easy to see and easy to access. Flammable reagents should be separated from non-flammable reagents. For reagents that are temperature sensitive, storage fridges and freezers can be used, as well as safety cabinets for flammable reagents. The lab should be considered as a restricted area, meaning only authorized personnel are allowed inside. As well as the lab rooms, the storage room and sample storage units should have restricted access. This access could be achieved through access cards and keys assigned only to authorized personnel. Another quality system essential is information management. It is one of the most important pillars of successful process implementation. By equipment integration to a LIMS system or a laboratory integrated management system that leads to enhanced sample traceability, as well as confidentiality and integrity of our data following ISMS policy. These LIMS systems allow for sample data viewing and modifications. Our next section to discuss will be regarding health and safety in the lab. There are basic health and safety measures that are important to be implemented. These include personal protective equipment that should be provided to all staff, as well as training on how to don and dope the PPE properly. First aid kits should be accessible and available. Biological and chemical spill kits, along with training on how to use them. Eye wash stations and showers should be implemented in proper areas, as well as training on how to use them. MSDS and SDS to be provided for all the chemicals in the lab. Finally, fire safety equipments to be available and training to be provided, as well as fire drills. Some non-physical aspects to consider regarding health and safety in a lab. Establishing a lab safety committee. They will meet up to discuss and provide updates on any health and safety issues and concerns. It's also a good idea to have internal lab safety audits performed on a periodic basis. Staff to follow good lab practices for continuous improvements. Trainings to be given to new staff, as well as refresher trainings to be given to existing staff. Since a lab generates different types of waste depending on the process to be performed, the waste generated should be handled and disposed of correctly as not to pose any health risk to lab personnel as well as the general public. Some common types of waste generated are biological, liquid, general, sharps, and chemical. Regardless of the type, waste should be collected in a designated and controlled area, and waste should be labeled and tagged correctly. Waste should also comply with a country's waste management and disposal laws. I will now hand over the remaining of the session to Ms. Eiman.
In this session, we will focus on the sample collection and the processing. There are multi-studies nested in Qatar Biobank. Each study requires specific design kit to meet the requirements. And when the kit is created in the lab, each kit has specific number linked to the participant. And these kits collected by our nurses from lab for withdrawal blood extraction from participant. There is an order for extraction the blood to avoid the additive cross-contamination. We are focused on the healthy participant and some infected patient. We collected different blood tube, urine and saliva from each participant based on the design of the kit, and maximum volume of blood is 60 ml. When the blood is collected and received to the lab, there is distribution of the sample. Some of the sample will go inside Qatar Biobank laboratory for initial fractionation of the sample, and the remaining of the tube, like 6 tube, 3 EDTA and 2 gel tube and 1 sodium citrate for biomarker analysis. As we are unique in our biobank, we will offer a full checkup, including multiple analysis and analysis ship for more than 70 blood biomarker, which this blood tube shipped to third-party governmental hospital. And when we received the data from governmental hospital, the medical team will provide the participant with the feedback on their result and referral if they needed in this stage. In the lab operation, our scope in the Qatar Biobank laboratory in the beginning as limited, as we started by manual fractionation. Then we will expand this scope in 2016 by start the first automation, which is easy blood fractionation, which was integrated with iLEMS. In 2017, we implemented further automation, like DNA extraction based on the magnetic bead protocol and simple process for measure the quantification and concentration and the purity. In 2018, we implemented 2 automation. One automation for RNA extraction based on the magnetic bead protocol. The other one is automation for quality control, such as SNP trace panel, to check the quality of DNA and cross-checking that the genotyping data is cross-binding with the phenotyping data. And finally, in 2019, we introduced our microarray, or Qatari chip, to detect any changes in DNA and discover any disease if infected by in the Qatari population in the future. We have seven laboratories in Qatar Biobank, or 7 process: sample receiving, sample processing, silver preparation tube, DNA extraction, RNA extraction, microarray, and finally the quality lab. There are quality control in any laboratory in the world. There is some pre-analytical, analytical, and post-analytical. In the pre-analytical phase, in this stage we have in the sample receiving and sample processing. In the sample receiving, there is some quality check. Like when we receive the sample, we should check the quantity of the sample and condition of the sample if there is any clot or hemolysis. Also, the transfer of the collected sample or the time from collected until we receive it to our laboratory should be within 15 minutes. And the transport of other non-clinical sample for the 70 biomarker analysis for governmental hospital should be with controlled temperature from 2 to 8 and within 4 hours. In the sample processing, our quality check should be processing within 2 hours as maximum, include centrifuging time and speed and serum clotting time. In the analytical phase, we have some also quality check, like we have as our process as initial fractionation, automated or manual, we needed some quality. To measure the white blood cell count, we use hematology analyzer for cell count, and also for behavioral blood mononuclear cell, we use it hematology analyzer for cell blood count, and also other method which is the flow cytometer to measure the cell viability. Then to detect the volume is dispensed in the machine in the accurate way or fractionation by personnel in the accurate way, we have volume detector to detect the volume. Also, there is analytical phases for other process in the lab, like DNA and RNA extraction. There is DNA quantification, we use it fluorometric process. And for purity, we measure by spectrophotometer process. And for DNA integrity, for genomic score, we use it microfluid process. And each type of the sample, DNA and RNA, have different range. And this is quality considered as analytical QC. There is functional quality QC only for DNA type. DNA fingerprinting for sample traceability, for sample swab, mix up, gender confirmation with demographic data. And in the microarray process, we have 3 different microarray in our Qatar Biobank laboratory. And we have some quality check, like a plate pass rate should be more than 95%, and the QC core rate of passing sample should be more than 98.5. And finally, what are the post-analytical phase in the quality check? We have the post-analytical in 2 processes, in the sample storage process and in retrieval and distribution process. The sample storage process, we use the sample inventory validation to manually check if the sample in the correct location, and my colleague Monika will speak more in details in this part. For retrieval and distribution, when we provide the researcher with the sample, we should prepare in the same time the quality report with all relevant information. The manual process. What the infrastructure required in the manual process? The workplace approved by Ministry of Public Health, constant room temperature. What the equipment required? Required simple equipment like pipette, tips, centrifuge, biological safety cabinet, microtubes, freezers, fridge, bench or table, and plate, and caps and secure. What the advantage and disadvantage from this process? The advantage is low cost, processing all material without complex software program, easily handling. We have limited number of aliquot in that time. We collected 73 from each participant. What the disadvantage? There is many human error. No sample tracking system, that means no traceability. Low sample quality. High number of collected sample to be processed need high number of personnel. And sample distribution plate, we have 4 plate. The first 3 plate are similar, but the fourth plate have different type of the sample, like buffy coat, urine, and saliva, and this is not replicated in other plate and can be lost at any time, as this is the only one copy. For automated sample process, as I mentioned, and the automation part, the advantage we can higher throughput, and we have good quality of sample. There is a traceability. There is organized sample distribution plate map, as we have 3 copies of a plate, and all plates are similar. The disadvantage is high cost. The backup required in case of any failure of the machine. The first quality system essential is equipment and its management. We are where we need to take care of various aspects such as installation. Before the installation, we should put the spec of the machine, then send it to procurement. Then, after that, we received the machine. We needed to make the installation by the supplier, validation, installation by manufacturer or the supplier, validation, maintenance, calibration, troubleshooting by the staff is required, repair and maintenance and service report if any things happen in the machine, and records for everything like checklists and records for troubleshooting by the action or accidents happen in the machine. Following should be considered before purchasing the device. Quality essential for establishing automated process, including device qualification. As I mentioned in the previous, we need to put the spec, installation qualification, operation qualification, and performance qualification. These will be discussed in the details by our colleague Monika in next part of the presentation. All equipment used should be documented. Our equipment maintenance is tracked through master list of equipment. For successful day-to-day operation, it is essential to have good documentation, easily accessible for all lab staff, and it has to reflect the last changes and the flow chain of approvals, revision, review, distribution, archiving, retention time should be documented. Here are some basic documents should be considered when establishing a biobank laboratory or any lab. policy and procedure, standard operator procedure or work instruction, health and safety program, chemical hygiene plan, risk assessment, business contingency plan, maintenance log sheet, checklist, procedure to address non-conformities, sample distribution, participant withdrawal procedure. Another quality essential system, purchasing and inventory, where we have developed work instruction to be able to have systematic approach to maintain our supplies and inventory management. And these included in this document, we included the vendor qualification, supplies and reagent, critical service, contract review, inventory management. And we should consider when we do any inventory, our consumption, clearance, expiry date of the reagent, shipment time, stability, license, dangerous good. Inventory tracking and monitoring is important to not face any shortage of expiry or expiry reagent. In the lab, we started off with a simple Excel sheet where we manual input information of the item received, and on monthly basis we would count the inventory and document it on this sheet. Then the IT department make it our life easy. They implemented for lab some system, in-house system, which is make it easy tracking and searching for item and monthly updated of the same. Also, in this system, there is privilege as there is restriction on who can edit the inventory and alerts for inventory running low and nearing expiry. Organization and leadership provide a framework for creating a culture of equality and continuous improvement. This needed human resource, job qualification and job description by different skills, as we have different tasks in the lab is required by different personnel, like we need to structure the org structure, to build our org structure, to include lab technologist, lab technician, lab manager, safety officer, quality officer, and each of them have different tasks than other. A systematic approach to managing and improving laboratory operation by identifying and addressing unexpected events or accident by occurrence management. And this contain complaints, mistake and problem, documentation, root cause analysis, immediate actions, corrective actions, preventive actions. QSE, process improvement, and customer service can help to improve the workflow, reduce errors, and enhance the quality of the result. Additionally, by prioritizing customer service, laboratories can enhance communication with the clients and provide high-quality service that meets or exceeds their expectation, in our case, with our stakeholders. In this process, we have opportunity for improvement. We have stakeholder feedback. We have a problem resolution. For sample storage, we have manual process, which was manual storage. We need simple freezers like chest, upright freezers and liquid nitrogen tank. There is a room temperature should be maintained as required. In that time of the building of biobank until 2015, 2016, we have Excel sheet to track the storage location. We have backup from the time of building a biobank laboratory. We have remote site location as a backup for any accident. What the advantage from manual storage? Low cost, not too high technology and complicated system. Any type of labware can be stored, but the disadvantage? Not easily to access to all samples. Freezer temperature fluctuation, it's happening through the retrieval process. No sample tracking as we use in that time, as I mentioned in the previous slide, Excel sheet. About the automated storage. We implemented our automated storage in 2018. There is different type of micro tube and different size. We have -80 storage zone and -20 handling zone, two-step of refrigerating, input-output. The capacity of automated store 2,300,000 sample. The backup will be secondary refrigerating and liquid nitrogen in this automated biostore, in the automated store in our laboratory. What the advantage? The advantage improved the sample quality, data directly stored in database, no constant staff intervention. The disadvantage, temperature control, humidity, costly to program and reprogram, space requirement. For sample distribution plan, as I mentioned, from the advantage of automated, we have high throughput. We divided the sample into 3 copies according to different storage location. We have automated -80 in our facility and the cryopreservation which contains 7 liquid nitrogen tank in our facility, and we have also remote site or backup outside the biobank which we keep the second copy of the sample there to avoid any disaster. But according to some size of the sample, we cannot storage in the automated store. We should keep it 1 copy, like for example, in case of Buffycode and Bexgene for extraction process, we keep it 1 copy for extraction and other copy we store it in our backup in remote site. And this is referred to ISPR Best Practice, 3rd edition, 2012. After implementation of our automation, we are able to increase our coating plan to produce more sample as we have high throughput. From 73, we reached in 2016 114 fractionation sample from each participant. But later, regarding to reduce the demand of some type of sample from the research, we reduce number of some sample, and in the same time we increased our capacity. And the QBB laboratory has worked on overcoming and challenges of sample storage validation as no reference standard or guidelines with formula to calculate the inventory sample storage validation. The inventory storage validation has been designed to cover systematically all sample storage condition, sample type, and the storage location based on defined percentage 0.1%. Now, there is a video to take you through QBB laboratory. Enjoy in this video.
Welcome to Qatar Biobank. Qatar Biobank was launched in 2012 as part of a collaboration with the Ministry of Public Health and the Hamade Medical Corporation. Through the collection of samples and information on the health and lifestyles of Qatari citizens and long-term residents, Qatar Biobank aims to make vital medical research possible for scientists in Qatar, the region, and the world. Qatar, like many places in the world, is plagued with complex health challenges such as heart disease, diabetes, obesity, and many types of cancer. We have created a proven mechanism that makes it possible to perform research utilizing new data in hopes of solving these challenging health problems. Our state-of-the-art biobank facility has drawn national and international acclaim as a premier biomedical research facility in the region. Our processes harness the most advanced technology, allowing us to advance and consistently deliver quality results quickly. Our highly educated staff, advanced technology and operational philosophy ensure the highest level of ethical and quality standards. The QBB utilizes the gold standard in laboratory equipment and techniques. Let me introduce you to some of this incredible technology, including a processing lab, a CPT lab, a flow lab and a DNA lab, in addition to the storage facilities. The samples are received here at the reception desk. The process begins with every sample being marked with a unique barcode. By generating the barcode at the time of sample collection, every sample is tracked through all the different processes and methods performed at the biobank. Some of our most sophisticated instruments automate and optimize our lab processes, and these include blood fractionation workstations, cell blood counters, and nucleic acid extraction workstations. These instruments perform at a level and are unparalleled in precision and efficiency. The blood fractionation workstation allows for fully automated blood fractionation and buffy coat isolation and is located within Qatar Biobank Processing Lab. This device is precisely engineered to support the sample preparation process and provides safety for sample integrity, its associated data, as well as the donor and operator. This system is fully automated, efficient, and allows sample tracking through the entire process. Viable cells extraction occurs in our biological safety cabinet in our CPT lab, which is designed to protect the sample, worker, and environment. Our flow lab conducts viability testing using various state-of-the-art equipment, including flow cytometry instruments. The cell counter is a precise quality control instrument we utilize for performing blood counts. This device delivers the ultimate in precision cell counts and is automated, efficient, and cost-effective. Isolation of nucleic acids is performed using state-of-the-art technology to ensure the best nucleic acid purification results for all downstream processes. This high-throughput device can handle a variety of sample sizes at relatively high speed, allowing the quick processing of samples in a single day. Our system gives you the flexibility to analyze samples immediately or safely store for later use. You will find our cryogenic and automated storage systems are state-of-the-art, with the capacity to store over 2,300,000 samples. Sample integrity is critical throughout all phases of the sample process, from collection to processing, storage, and delivery to the researcher. Our storage systems maintain the integrity of the stored sample for future use. Qatar Biobank's storage facilities are secure and comply with international biological storage and safety standards using proven fail-safe measures, which include rigorous compliance and monitoring systems, along with O2 level detectors. We pride ourselves on our commitment to quality and information security. Qatar Biobank is ISO accredited for QMS 9001 2015 quality and ISO 27001 2013 information security management, which provides assurance that our procedures are standardized and validated, and the quality of our samples and data collected are consistently high. We have set the standard for biospecimen and clinical data collection, allowing researchers to imagine a better future of personalized medicine through the work of Qatar Biobank. We warmly invite you to visit us today.
Thank you, everyone. Now we are so happy to answer any question.